So, we talked about what clinically severe obesity is. We talked about the treatment options with surgery. The next question is, which surgery is going to be good for you? That question is best answered after you do your research, just like attending this seminar, when you sit down with your surgeon and discuss your particular situation. But you have to understand the pros and cons of each of those options. So the issues involved are, some of them involve more surgery, like gastric bypass requires more surgery. Some of them are reversible, like the adjustable band is reversible. We can take the band out and things would go back almost to the way they were, whereas gastric bypass, for all practical purposes, is not reversible. The band involves a foreign body. There is clearly higher risk with gastric bypass compared to the other two options. The weight loss appears to be more dramatic and faster and probably more at the end with gastric bypass compared to the other options. There is maintenance with the adjustable band in terms of the adjustments I was telling you about. And age also can play a role in that decision making. This is surgery. There are potential risks involved with surgery, and it's important to understand them. Gastric bypass can be affected by infections. There is a type of infection particularly which can be very dangerous. If the connection between the new stomach and the intestine, or the connection between the two portions of the intestine comes apart, something called leak can happen. A leak is a serious infection. Bleeding, blood clots can happen. Blood clot can happen with any type of surgery. Unfortunately, when people are overweight, they have a higher risk for this problem. We take many precautions to minimize that risk, and we'll talk to you about that at the consultation time. But the risk is still there. Ulcer, hernia, dumping syndrome, hair loss, vitamin and protein malnutrition are some of the other risks with the surgery. Lap band or adjustable gastric band also has its own potential risks. Infection can happen, although of a different type. Perhaps the more common complication we see something called slippage, whereby part of the lower stomach can actually slide underneath the band and get pinched in there. That may require surgery to fix it. Blood clots can happen there as well, and we do many things to minimize it. Erosion of the band is a very rare event, whereby the band actually eats into the stomach wall. Poor weight loss is something that can be seen more commonly with the adjustable band compared with the other procedures. Sleeve gastrectomy, the risks can be similar to gastric bypass, although to a lesser extent. Again, infection due to leaks can happen, blood clots. Those were the risks. How about the results? The results are fantastic. Nothing short of that. The common result is at least 50% of the excess weight being lost, improvement in almost all illnesses associated with obesity. In some cases, those illnesses go away. Improvement in quality of life, improvement in self-esteem. So, great tools, those surgeries. Remember, I'm using the word tools. They are not the miracle answer. They are the tools, but they are very powerful tools. So what's the answer to success after surgery? Number one, commitment. I talked to you about that earlier on. When you make a decision to have surgery, it's not a decision that you make overnight. You think about it. And perhaps many of you rejected the idea when you heard about it first. It took you a while for that to mature in your head and accept it, that it is something you need to consider. Once you make that commitment to have the surgery, at the same time, it is critical that you commit yourself also to change many things in your life, to take that opportunity for that change. So commitment is very important. The second very important thing is commitment again. And the third one is, you will guess, commitment. as you go through our program, you will see that we emphasize on this issue greatly. Life after weight loss surgery, eating habits will change. Exercise is a very important component of life afterwards, and lifelong follow-up is critical. Is weight loss surgery right for you? That's a question obviously that is best answered again when you come for your consultation and talk about your individual circumstances with the surgeons. But research your options. You will need a medical preparation. You will need evaluation by many specialists and extensive education. You have to be patient. You shouldn't compromise for your safety and ask questions at any time. I will be taking questions, but I will do that actually after our guests speak.